What's going on, everyone? Happy Tuesday. Hopefully everyone is doing well, staying safe, healthy, and having a great day so far. And I really hope you are testing negative for these viruses during a time where COVID is once again rising in the United States. It is time now for the Tuesday edition of the Virus Update for Tuesday, July 15th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there, and I give you updates each and every day. Sometimes they're 10 minutes, 15 minutes. Sometimes they do even go over 20 minutes. Today will not go over 20 minutes, but want to stay informed with what's going on with these viruses, subscribe to my channel down below, give this video a thumbs up, hit that notification bell, share this video with anyone you know, and of course, leave your comments and ways to support the channel are listed down below. Thank you to all who have supported the channel down below. Someone did yesterday. You know who you are. Thank you so much. Alrighty, we do have just a few news stories today. Then we're going to take a look at some daily data and one bit of weekly data. I think this is going to be a 15-minute video, but let's see what happens. Starting off with something from Dennis, the COVID info guy. The United States COVID-19 cases are now said to be rising in 25 states. We've seen that in the CDC data. We're post 4th of July. We're following the NB.1.8.1 variant, but more importantly, we're following that XFG variant, which continues to rise. Here's a little excerpt from an article that he shared. Some of the biggest increases in emergency room visits for COVID have happened in the Pacific Northwest and the Southeast. In those areas, rates are now the highest they have been since February and March. And we will look at more on that in just a few moments. All right, you might be wondering, well, COVID's now rising. What happens next? Does it continue to rise? Well, Mike Horger does have his forecast out, and it says we estimate 1 in 148 Americans are actively infectious at this time. This equates to 2.3 million infections a week, expected to result in 100,000 new long COVID conditions and 800 deaths. So in other words, yeah, this week's infections could lead to 100,000 new long COVID, and that could be anything from something really minor that's just irritating to something much more serious that impacts your daily life, that impacts, you having the ability to do things that most people would normally do. Yes, this happens with COVID. And taking a look at his graphic here, we can see here, looking ahead, it looks like things are going to continue to rise based on his forecast. And it says here's the PMC COVID dashboard. This is as of July 14th, yesterday. Transmission red is closely tracking the path of 2 years ago. And I said that, I want to say it was about a week or two ago now. I said, things are looking very similar to what we saw in 2023. It is not looking like last summer. Last summer got going a lot sooner, and it just took off, and it just continued to take off. This is looking more like the lines of 2023. And he is seeing this as well. And it looks like his model is saying things are going to continue to go up, and they may go up rather quickly at this point. So daily infections, yes, they are expected to continue to rise here in the United States. If you want to read this full thing, I think today or later this evening, I will do a thread or a post on my site with the news stories used. And I'm also going to be updating. Probably not going to get to it this week. Maybe while I'm on vacation. I'll actually have more time to work on these things when I'm on vacation. Maybe I will add a post on my site with all the various different users you see me share from X. It was asked about yesterday. It needs to be done. Maybe I'll just add it to the things I use and something like that. It's time that I do that because I know you want to see these different accounts, and maybe you don't know their handles or whatever the case may be. Speaking of seeing things, I saw this today while out doing deliveries. Yes, look at this. As seen in Chester County, Pennsylvania, I believe it was the Tradifton Township School Administration building, and I delivered in the office and saw this sitting there. Free. Take as many as you want. What may that be? These guys right here. You see me show this same box for multiple years now. Take the iHealth at-home COVID test for free. Someone's going to ask, did I take any? Well, no, it's for the employees of the Tradifton Township School Administration. But, yeah, this tells me they know darn well COVID never ended. They know it still exists. They know still people still get sick. And there you go. They have a test sitting there in their office. How about that? Yeah, I thought that was really interesting to see. All right, there is a Salmonella outbreak ongoing in Canada. Yeah, 84 total illnesses, in other words, 84 total cases and 9 hospitalizations. And it looks like this may be linked to some sort of salami. Yes, contaminated salami has now infected the 84 people across the Canadian provinces, with 9 of those requiring hospitalization. So, yeah, this is not a good thing at all. Something we will continue to follow. All right, take a look at this from Sci-Fi. I told you we had more when it came to the emergency department visits diagnosed with COVID. And take a look at this. It's continuing to rise. And not only is it continuing to rise, it's starting to get concerning for an age group. Update. COVID-related emergency department visits for ages 0 to 11. You know, that age group in the early day of the pandemic. They said, oh, kids can't get COVID, man. Well, guess what? They do. Emergency department visits for ages 0 to 11 are at the highest since August or September in California, Florida, Texas, and Hawaii as of July 10th. Remember, they did an update on Monday. So, yeah, emergency department visits, they're rising at this time. All right, taking a look at measles. We do have a measles update out of Texas. And remember, it was 753 cases, and it's gone up. 9 new cases there. 762 cases total now in Texas. And when we take a look at vaccinated versus unvaccinated, we do see that 719 were unknown or unvaccinated. 1 dose of vaccine, 22 cases. 2 doses of vaccine, 21 cases. So, yeah, the number of cases in measles in Texas, after not going up for some time, has gone up once again. Alrighty, here's my website here, datareport.info. You can find a lot of information on my website. I'll be doing some work on the website while I'm up in the great state of Maine next week visiting relatives. You'll see some maintenance and some minor things go on that list. That's where I'll be made. Taking a look at this now. One more bit of measles news. New measles case in Iowa linked to Cedar Rapids. Several Iowa cities, yeah. Another case of measles being reported in Iowa. This is the 7th confirmed case in the state and 6th in the eastern part of Iowa. Yeah, not a good thing whatsoever. We'll get a new update on the United States measles as a whole on Friday. We probably won't get that in the update until Saturday. Note, anything CDC that updates Friday is not likely to be in until for us on my videos here. I probably will not be showing them until Saturday. I'm either going to pre-record something Thursday evening for Friday, or do our early virus update and then have it scheduled to release later in the day. That is a travel day for me. Don't worry, I'm not taking any airplanes. It's travel by car. But I gotta tell you something. Now's as good a time as any. If you are going on a road trip or traveling anywhere, be mindful of those rest areas, the places where you stop to take a break, wherever. Hey, COVID could be there. You know, a lot of people congregate together in those different places. So please be very careful. Some of these rest areas get very crowded. I know I'm going to be passing some that are crowded. We know which ones are less busy. We've been doing this trip since before I was born. My parents have been going to see my aunt and uncle, be my mom's sister, who we're going to see, and their brother-in-law, and they're actually my godparents. But we know which rest areas are less busy. Like, there's a couple places that we'll be stopping at that will hopefully not as busy. But, you know, it's the northeast corridor of the United States. Something goes wrong on the road, there's an accident or something, people will stop at any which rest area because, the traffic was I got to use. So you got to be prepared. You just have to be. All right, moving on. Taking a look at Canada's viral activity levels, which is just north of Maine. COVID-19 is low, flu A is low, flu B is low, and RSV is low at this time. We will not be getting an update from the UK until Thursday. That's the Thursday edition of the virus update for that. Taking a look at what is going on with air qualities, I doubt we see much in the way of improvement. Yeah, we're still seeing some oranges and reds, and unfortunately, take a look at this. They did make their way, the bad air qualities did make their way over into portions of New England now. I was afraid that was going to happen. We're also seeing Oregon's having some problems. California, look at north of Montana, up there in portions, and also up in portions of Alberta, Canada, And then to the east of it, yeah, I think we got some new wildfires, which would be causing that. Definitely Oregon. Yeah. This does not look good in Oregon. All right, moving on. Taking a look at the breathing index for today. It's not great in the West Coast where those new wildfire concerns are. It's also not great here in the Mid-Atlantic. Northeast is not terrible. A few spotty issues in the South, and also a few spotty issues in Canada today. If you live in any of these areas, please take your breathing seriously, especially if you have COPD, asthma, or any other breathing-related condition. Taking a look at what's going on in Pinellas County, Florida, we do see there are a few problems going on there at this time for EMS calls. Philadelphia yesterday, 861 EMS incidents, and you're seeing this here. No, it's not because there was flooding rain yesterday. Yes, we had flooding rains yesterday. There was or I don't think that's because of the flooding rains. There was a huge water main break in part of Philadelphia yesterday. That may be why you're seeing that picture. Taking a look at what's going on with EMS calls in Montgomery County right now, dehydration is on the list, and we need to pause and take our hydration break. But I tell you what, this for me is not really a hydration break, because I've learned something. Today, the drink of choice is lemonade. Guess what I have learned? Lemonade. It's not good for keeping you hydrated. Usually we use water. It's a hot day here. Lemonade's refreshing on a hot day. Huh? It at least feels better on my throat. Don't worry, I'm going to be drinking water or juice after this. I'll be hydrated. Moving on now to what's going on in Chester County, if we can. Okay, it did come up. And we can see, quite a few calls for Chester County at 5:28 in the evening. Taking a look at what's going on in Bucks County, and I need to refresh this because it does not refresh on its own. 6 active EMS calls there right now. Taking a look at the hospital situation in Pennsylvania, and we can see, oh my, I'm seeing a lot of yellow in the Lehigh Valley of Pennsylvania. That's not good. That's a lot of hospitals that are dealing with some sort of an issue, whether it be behavior, health issue, or emergency department overcrowding issue. Then we come to this, and let's go to the state-wide portion first, and this is Pennsylvania's weekly wastewater update. We are going to put this in a window of its own so you can see what's going on. Right now, Pennsylvania is still listed at very low. The levels did not rise. But if you recall, last week, I was telling you there were some big doings up in State College, Center County, Pennsylvania, also Center Hall, because there were 2 big events. And I said, I'm concerned. There's be a lot of people. I mean, both were slated to have over 100,000 people. Now, some people went to both events, and that counts as attendance for each event. But you get my point here. Take a look at this. Wastewater in State College, Pennsylvania has now started to go up. You can see it here, clear as day. It's doubled from where it was a week ago. It has started to go up. And it's probably a direct result of what happened. And mind you, that was only just a few days ago. So probably seeing the effects of 4th of July. And it's probably going to continue to go up. You can see last year, that's on or about the time it started to go up. And it bounced around, went up a little bit. Then when the students went back to Penn State University, you can see last year, they had a much bigger rise. The latest variant in Pennsylvania is the XFG variant. Taking a look at what's going on in New Jersey for the hospitals, and we do see here, are there any problems? We're seeing the Robert Wood Johnson University Hospital, an adult emergency department problem patient volume at this time. Never good to see that. Walgreens this week, if you did not see the update, the positivity rate is 26.5%. It does continue to go up, we'll say rapidly rise at this point. New York State is now seeing a rise for cases. And take a look at this. Remember yesterday we talked about Saratoga, New York? Well, Saratoga, New York does report 2 cases of COVID. I don't know if one of them is my relative. I really don't know if they did an at-home test or they got a I honestly don't have the answer for that. But things are starting to rise. And check this out. New York State hospitalizations. Yep. Going up. Let's see. Do I have that set for statewide? Yes. 237 people in the hospital. And that is an increase. Yes, that's one of the bigger increases that we've seen in a while. It was before that 208. And when we click on New York City, this will probably refresh on us, but we'll get New York City. Take a look at this. New York City saw a significant increase. They had 98 people in the hospital. Now that has jumped to 119. And take a look at the hospital admissions. Here's New York City. Yeah, New York City hospital admissions, they're going up now. It's not good. And I think eventually the emissions on a nationwide level in the United States are eventually going to lead to higher hospitalizations. Now, we did see emissions go up on a statewide level for New York State, but honestly, I think the increase that we're starting to see now from New York City itself is bigger. Yeah, I mean, yeah, you can see here it's starting to go vertical. That's not good, and I think the trend's going to continue. We'll see what happens next Tuesday. All right, let's just take a look at one wastewater site. No, not Portland, Maine. Let's just randomly look at somewhere. And how about we go, uh-oh. I'm seeing, yeah, Salt Lake City is now coming up high. This is new. You can see here the level continues to rise there. Yeah, this is not good whatsoever. COVID level is now listed high, and it is continuing to rise. And let's keep in mind the western coast of the United States is now listed at high. Let's take a look at that chart and see if, oh my. Now, there's some wonky movements here. This will get corrected to not as harsh, but you get the point here. Wastewater is rising at this time for COVID in the West Coast. Not good. Alrighty, folks, that does it for the Tuesday edition of the Virus Update. We will have another update again tomorrow. If you liked today's video, give it a thumbs up. Subscribe down below if you're new. Hit that notification bell. Share this video with anyone you know. Leave your comments down below. And you can also support the channel down below. I will see everyone again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Tuesday evening. Thanks for watching.